Welcome to Toledo Clinic TV. Our guest is Dr. Lisa Graves Austin, and she is here to talk about diabetes. It's a very broad subject, and it makes headlines all the time because it's so prevalent. Are you seeing more of it in your practice?
It's absolutely an epidemic. The incidence of diabetes has escalated tremendously just in the last 10 years. We are seeing type 2 diabetes in as young teenagers, and it's important to know the difference between type 1 and type 2. Type 1 diabetes essentially means that the pancreas that makes insulin is not making insulin at all, and this is usually due to what we call an autoimmune condition. So the pancreas itself doesn't work. Those people have to take insulin. What we're seeing an increase in is type 2 diabetes, where people develop what's called insulin resistance, which means through lifestyle or genetic factors, the insulin that they produce is not being accepted by their cells, which makes their pancreas work harder, which eventually the pancreas just can't keep up with it and their blood sugars increase. So we're seeing a massive increase in obesity in this country. I think it's estimated now almost 60% of Americans are overweight or obese now. And just 20 years ago, it wasn't anywhere near that. So we really are reaching epidemic levels and new onset diabetes. So it's just a tremendous problem.
And prevention is probably the key.
Absolutely.
What can we do to prevent it?
Absolutely. First of all, know your family history. Diabetes type 2, there is often a genetic link. It is very important that you speak to your doctor about your individual risk factors if you have a family history of diabetes. So, number one, knowing that, keeping your weight healthy. Obesity has a very strong link to type 2 diabetes because it is a harbinger of insulin resistance, which tremendously increases your risk for diabetes. Eating healthy, being active, talking to your doctor about blood work. There are blood tests that can check for the early onset of diabetes. Don't wait until you have full-blown symptoms of diabetes before you get checked.
Diabetes itself is a difficult condition to manage, but it can also lead to other problems down the road if it's not controlled.
Absolutely.
Talk about those.
Well, diabetes, as you know, increases glucose, sugar in the bloodstream. Well, why is that important? Essentially, you're putting battery acid into your bloodstream. High circulating glucose causes inflammation in every vessel of your body. It attacks your nerve endings. So you can imagine what the long-term complications of diabetes are. Increased risk for stroke, heart attack, nerve damage, increased risk for cancers because of that chronic inflammation. So keeping your sugar, it's not just about keeping that number low, it's about preventing that inflammation.
Okay. Anything else that people need to know about what they can do to prevent it, and then what they could do perhaps to reverse some of the problems once they have them?
Absolutely. We're in a nation now that we have such tremendous medications we didn't have just 20 years ago. There are wonderful medications now that can reverse diabetes, that can certainly suppress the insulin resistance and reverse that inflammation. So patients who have pre-diabetes or early diabetes, if you get on it early and really work on those risk factors, you can prevent those long-term complications like preventing heart disease, preventing a stroke from happening. So there's so much we can do as a preventative.
All right. Thank you so much for being with us.
Okay.